Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon. We are a bit earlier than usual, so I do not have all of our standard numbers. However, the website will be updated at 3:30 today with all of the COVID-19 data. I can say that we have now administered more than 608,000 doses of vaccine in our province. Over the last 24 hours, we have identified 545 new cases of COVID-19 and completed about 8,300 tests. This puts our positivity rate at about 6.5%. We have identified 249 new cases of the variants of concern. About 27% of our active cases are currently variants of concern. There are 288 people in hospital for COVID-19 treatment, including 64 admitted to the ICU. I am pleased to say that no new deaths have been reported to Alberta Health in the last 24 hours. Today, I want to provide a couple of important updates about Alberta's vaccination program. The first is about the AstraZeneca vaccine. Following extensive discussions with our provincial and federal partners, Alberta is temporarily pausing the use of AstraZeneca in anyone under the age of 55. This is a precautionary measure that is being taken across Canada. As I mentioned to you last week, there have been some rare instances of blood clots reported in Europe that require more investigation. While all available data and evidence shows no increase in the overall risk of blood clots for those who receive AstraZeneca, in a very small number of people who received the vaccine, a blood clot in the brain was reported 4 to 20 days after the vaccine. These incidents are rare, and at this point seem to be linked to AstraZeneca, possibly through an immune response. There is no evidence of any similar issues linked to the other vaccines that we are using in Alberta. There have also been no reported cases of these blood clots following immunization in Alberta or anywhere in Canada. However, safety is always our top priority. This pause will allow Health Canada to conduct further assessments and gather more information from around the world. This change is based on new information reported late last week and over the weekend regarding some additional cases and a lack of a connection to a specific lot or batch of the vaccine. I want to assure you that anyone under the age of 55 who has already received a dose of AstraZeneca vaccine is not considered to be at high risk of blood clots. However, as with anyone who receives any medication, including vaccine, they should monitor their health and seek immediate medical attention if they experience health concerns. We will continue monitoring the emerging evidence around this issue. We will also continue doing everything possible to ensure that our immunization program remains safe and effective. Studies are underway that will help determine what vaccine those already immunized with AstraZeneca will be able to receive when it comes time for their second dose in the months ahead. I know this sort of news may cause some concern for Albertans, and that is understandable. However, I want to assure you that this temporary pause is the result of our robust safety monitoring working the way that it should. I also want to reiterate that there have been no safety signals related to the other vaccines we're using in the province. The AstraZeneca vaccine remains a good choice for those who are at risk of severe outcomes from COVID-19, who would otherwise have to wait several months to access a vaccine. It is important to remember that AstraZeneca is very effective at preventing severe outcomes from COVID-19 infection, and that COVID-19 infections come with a very significant risk of blood clots and other complications. In other words, the benefits of getting the vaccine far outweigh the small potential risks in groups more likely to have severe outcomes from COVID-19 infection, such as those age 55 and older. Because of this, we will continue to offer it safely for Albertans over the age of 55 when more doses arrive in the coming weeks. The second vaccination update I want to provide today is letting you know that Phase 2B of our immunization program starts tomorrow. This phase focuses on immunizing anyone with underlying health conditions that put them at high risk of severe outcomes if they contract COVID-19. This means that cancer patients, transplant recipients, individuals with severe disabilities, dementia, and other conditions will be able to get the vaccine. The list of conditions is long, and I encourage everyone who may have one of these conditions to visit alberta.ca/vaccine to find out if they are eligible. I know that many people will be excited that Phase 2B is soon to be underway. At the same time, we must ask for Albertans' patience. With nearly 1 million Albertans in Phase 2B, this is the largest single group we have made eligible for vaccination. With limited supply, we will have to move slowly and take small steps until more doses arrive. Starting tomorrow, Albertans born in 1963 or earlier with underlying health conditions can book an appointment at participating pharmacies in Calgary, Edmonton, and Red Deer. Pharmacies in other communities will start booking later next week as more doses arrive. Starting April 5th, all Albertans born in 1957, 1958, and 1959 with one or more of the high-risk underlying health conditions will also be able to book appointments with Alberta Health Services. Additional birth years in Phase 2B will become eligible as more vaccines arrive. Thank you in advance for being patient through the process, and thank you for being kind to the staff who are helping along the way. We are not requiring a doctor's note or other proof of one of these conditions to get high-risk individuals vaccinated as soon and as efficiently as possible. I know many Albertans will benefit from vaccination, including those with other medical conditions. But I urge people to wait their turn and ensure those at the highest risk receive protection first. I would also like to remind individuals in Group 1 and 2A that you continue to be eligible, so please book your shot as soon as possible. As I've said before, immunization saves lives. The highly effective protection against COVID-19 that they offer far outweigh the rare risks that may be possible. We continue to monitor every dose for any adverse events, and so far we have not seen a significant increase in the rate or severity of reactions. If there are any safety signals reported here at home or around the world, they are investigated quickly and thoroughly to ensure we're taking the appropriate steps to protect you. Today's announcement on pausing AstraZeneca is proof of that. Every day we immunize thousands more people across the province, and every day we get a little closer to a safe return to normal. I know that many people are eager to move on, to ease restrictions and start moving past this pandemic. It will take a few more months, but there are things that each of us can do to help make that happen. The first is to get immunized as soon as you are eligible to do so. Also, support those around you in getting the vaccine as well. Make sure your parents, grandparents, and extended family are aware of the vaccine and how to book their appointments. In the meantime, please continue to respect the health measures in place to slow the spread of COVID-19 and to protect each other. Twice we have bent the curve before by limiting in-person interactions and by protecting each other in our communities, and we can do it again. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Media are welcome to ask one question and a follow-up, or if they'd rather, get both questions at the first go. Operator, could you put through the first caller, please?
First is Jeff Black with 660 News. Go ahead, Jeff.
Hi there. Thank you for taking my question. How much does this affect our vaccine rollout plan now that we're pausing the AstraZeneca doses? Will this shift our target of having all adults at least receive their first shot by the end of June, or will we still be able to meet that?
Based on what we're currently anticipating we will receive in the next several months, we believe we may still be able to hit the end of June target, even without using AstraZeneca. Of course, this will depend on receiving the amounts of Pfizer and Moderna vaccine that we anticipate, but we believe that, that it still may be possible to meet that target.
Jeff, is there a follow-up question?
Yeah, I just want to get your thoughts on what the damage might be from this, because we've kind of gone back and forth where before it wasn't recommended. AstraZeneca wasn't recommended for people over the age of 65. Now we're saying it's not recommended for people under the age of 55. Are you worried that people are just going to avoid this in general because there's been such a flip-flop?
I think that, of course, it can be confusing for people because there have been, as you say, different recommendations when it comes to the use of AstraZeneca. It's important for people to know that the initial recommendation regarding use of the vaccine only for those under 65 was not based on any kind of safety issue, but rather based on a lack of information from the initial clinical trials about how well it worked in those over 65. And once we were able to get additional information from real-world use of the vaccine in the UK, where use of the AstraZeneca vaccine in those who were over the age of 65 showed significant protection against those severe outcomes of hospitalization and death, then we had the ability to say, yes, this vaccine has proof now that it does perform well in those age groups. So it was a different reason for that recommendation. But again, I recognize that for some people, they may be feeling concerned. But what I want to say again is that the reason that we have decided to take this temporary pause is so that we have a chance to gather additional information for those in younger age groups who are not at as high a risk. Of course, everyone has some risk of having severe outcomes, but we want to make sure that we gather all the information to provide a robust, informed consent to that younger age group. And so I would encourage Albertans, again, to rely on reliable sources of information. And if they have any questions about AstraZeneca, we will be putting additional information on our website and communicating out to physicians and pharmacists across the province so that we have the ability to support them in the conversations they have with patients about the risks and benefits of options available to them.
Operator, could you put through the next caller, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. In BC, we just heard the health officer there announce new restrictions, especially targeting restaurants, but some other things as well. I'm wondering, I think their cases are increasing faster than they are in Alberta, but at what point, just given some of the numbers that we've seen with cases and with variants, does Alberta start to think about something similar?
We are always monitoring our data, not only the overall trends and, of course, the rise that we've seen lately in new cases and subsequent beginning to some increases in our hospitalization that are concerning. So we are monitoring those things. We're also watching to see where our new cases are coming from. And as I've said before, one of the biggest challenges we have right now is that across many different sectors, many people who are feeling perhaps frustrated or tired of restrictions are not following the measures as much as they were before. And so the real question is what kinds of additional measures would be the most effective to help remind all of us that we are not through this yet and that we don't have enough immunizations offered to our population to be able to reduce the risk of a wave of cases becoming a wave of admissions in acute care. So it's something that we look at continuously, but again, no decisions, no recommendations at this point in time.
Is there a follow-up question, James?
Definitely, yeah. So what would you see turning around our current sort of trajectory? Because, vaccines, we're seeing that rolling out slower. In the fall, we had a pretty sharp increase, kind of similar to what we have now. And really the only thing that stopped that was more restrictions, right? We had a lot of appeals to personal responsibility and people to do the right thing, but in the end, rules are what did it. So what do you think would be able to turn this thing around right now?
Certainly, as I've said before, we may need to put additional restrictions in place, and we will be again looking closely at the data and determining if that is necessary in the weeks ahead.
Operator, could you put through the next caller, please?
Next is Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hi, Dr. Hinshaw. I've learned there have been cases of COVID-19 previously at Grace Life Church. So how many cases were linked to this church previously in the past? Are there any current or outbreaks, and are they working with contact tracers?
I would have to get that information from my local colleagues, as it is the local public health teams that deal with those specific local outbreaks. So I'm afraid I don't have those specific pieces of information at this time.
Is there a follow-up question, Lauren?
Yes. With Grace Life leadership and churchgoers continuing to flout rules ahead of the holiday weekend, are you worried other groups, religious or otherwise, will be discouraged about the sacrifices that they've made, or possibly be emboldened by the lax actions by AHS on this file? That seems to show that they can get away with it too if they just don't feel like following the rules.
What I know is that the vast majority of Albertans, both individually and in their organizations, so for example, the vast majority of faith leaders who we have heard from in the town halls that we've had on this topic, know the importance of protecting their communities from COVID-19. And I think it's important to note that there have been repercussions for this particular church. And it is, again, something that in government, we set the policy, and then law enforcement actions really are dealt with by the agencies that have the ability to do so. It's really important to remember that the consequences that come from activities like what we're seeing at this particular church aren't just the sanctions that, again, have been put in place, but the consequences are also the potential that these events become super spreading events for variant or previously dominant strains of COVID-19 that can then ripple outwards into the community and cause severe illness and potentially even death. And that's something I think most Albertans don't want to be a part of.
Operator, could you put through the next caller, please?
Next is Don Braid with the Calgary Herald. Go ahead, Don.
Dr. Hinshaw, how many people in Alberta under 55 have been vaccinated with AstraZeneca?
It's my understanding that approximately 900 people under 55 have received a dose of this particular vaccine. Again, we believe that these individuals are not at high risk of blood clots. However, going forward, again, we're pausing to get more information to be able to offer detailed informed consent if we are able to offer to this group again. What we have done is we have communicated to clinicians across the province to make sure that they are aware of what they would need to do if someone were to present with this particular syndrome. It's not something we have seen in Alberta or Canada to date, and we believe the risk is low. However, we also think that we owe it to Albertans to look more closely at this safety signal, given that over the past several days we have been informed that the events are not linked to a specific batch or lot, and also that there have been some additional cases reported in Europe.
Is there a follow-up question, Don?
Will you communicate directly with each of those 900 people? And also, how many people, if any, have been vaccinated a second time with AstraZeneca?
So in terms of communicating directly with those individuals, that's something I'm not aware if that's something that Alberta Health Services is planning to do, but I can take that away and we can follow up. With respect to the question of, sorry, what was the second question?
It was how many people who have had their first dose of AstraZeneca have also had their second dose?
No one has had a second dose with AstraZeneca, as we only just began offering this vaccine several weeks ago. And so individuals who received this vaccine would not be eligible to receive that second dose for several more months.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. So what should people who already received their first dose of AstraZeneca do? What should they be monitoring?
It's important, again, as anyone who receives a medication, including a vaccine, if they see any kind of unusual symptoms or signs, that they would talk to their healthcare provider. What we've seen, again, in these extremely rare reports from Europe, the most severe outcomes have been these blood clots in the brain, and so anyone who's experiencing, and quite frankly, anyone who experiences these symptoms should also immediately call their healthcare provider, whether or not they've had a vaccine. But anyone who has a severe persistent headache, particularly between days 4 and 20 after receiving the vaccine, If someone experiences again, seizures, if they have an arm or a leg that goes pale, cold, or turns color, these symptoms of significant blood clots, again, no matter who experiences these symptoms, they should call their healthcare provider because there are also many other causes of these kinds of blood clots. But it's those particular symptoms people should be watching for, contact their healthcare provider, and we have been in communication with clinicians both on Friday, and we're sending out additional material today to make sure that clinicians are aware of this syndrome and how to report it so that we're able to understand if this does happen. Again, the risk, I believe, to be extremely low, and so we do not believe that this is likely to happen, but we are taking a precautionary approach.
Is there a follow-up question, Julia?
Yes, there is. And when it comes to that second dose, are there still plans for Alberta to go ahead with a second dose of AstraZeneca, or could those who have already received a first dose get a second dose from a different manufacturer?
Because we have a few months before we would be offering a second dose, and with AstraZeneca, we actually know that receiving a second dose at around that 12-week or 16-week interval actually provides greater overall protection than receiving a second dose at a shorter time interval. So we do have several months both to look at what the evidence is with this very rare clotting event to determine if it is something that we can identify. Perhaps there's very specific risk factors where we're able to target people who don't have that risk factor to receive a second dose. The other thing that we'll be able to get more information on in the coming months is the clinical trials that are being run out of the UK that are looking at the effectiveness of mixed dose schedules. So having an AstraZeneca vaccine first, followed by a Pfizer vaccine, and we anticipate we will have early results from those studies available within the next several months. And so those kinds of pieces of evidence will help inform the decisions about what kinds of vaccines we'll be able to offer as a second dose to these individuals.
Operator, could you put through our second last caller, please?
Tricia Kindleman with CBC Edmonton. Go ahead, Tricia.
Thank you so much. Good afternoon, Dr. Hinshaw. Just a question in regards to the variant of concern. It looks like we're up again slightly over yesterday's percentage. I believe it was 27% you said off the top there. Mm-hmm. Just wondering if, given the fact that it's spring break for many students in Edmonton and across the province, are you concerned about that potentially fueling the speed of transmission?
Certainly, if people are making decisions to gather socially or to engage in activities where COVID-19 could potentially spread, that could fuel transmission. What I continue to advise and encourage Albertans to do is to remember that our actions today are going to be dictating our case counts in 2 weeks and our hospitalizations in about 4 weeks. And so we really need to remember that the things that we choose to do are going to have an impact not just on us, not just on our family, but on our communities as well. And so I would ask all those who are off on spring break to make sure that they're continuing to follow the public health measures, whatever it is that they're doing, and choosing activities that are safe, not just for them, but for their communities as well.
Is there a follow-up question?
Yeah, there's some data circulating online that shows doubling time to be about a week or so, 7.5 days. Just wondering if your numbers are kind of showing that same thing, or what you might be able to say about that situation.
I haven't seen our internal analysis with respect to doubling time lately. What I can say is that our R value, our reproductive rate that shows how quickly the virus is growing or spreading, is higher for the variant of concern cases than it is for all of our cases together. And so we know that we have crossed over that threshold of 1, and we have a reproductive number of higher than 1, and we have had so for several weeks across the province. But concerningly, our variant of concern cases have a reproductive number of 1.35, again showing that differential. And so it just goes back to the point that we've been discussing before, which is that all of us, if we are wanting to make sure that we're part of the solution and protecting our communities, need to be thinking about our actions every day in advance of when we take those decisions, when we do those actions, because these variants of concern can spread very quickly and easily if given the chance, and what we need to do is stop those chances for spread from happening.
Operator, could you put through our final caller, please?
Final question is Lauren Krugel with the Canadian Press. Go ahead, Lauren.
Hi, good afternoon. I'm just wondering how much of that AstraZeneca we actually have at the moment, and if there's a danger of any of that going to waste. I don't know what kind of expiries there are, or how many people above 55 might be in the queue for that.
I don't have an exact number. I understand that the number of doses we have is less than 200 at this point in time, and I understand that none of those doses will be expiring before May, so we do have some time to offer that to Albertans. And again, we know that AstraZeneca, from real-world evidence, is very effective at preventing severe outcomes from COVID-19, which is why we believe it is a good option for individuals who are at high risk of those severe outcomes when there is this very low risk of these adverse events from vaccine.
Is there a follow-up question, Lauren?
Yeah, just a brief one. You had mentioned that the people who are under 55 who have received that vaccine to date are believed to be at low risk of the blood clotting. I'm wondering if you can elaborate on why that is, what sort of risk factors they don't have versus perhaps other populations.
The reason that they would be estimated to be at low risk is because this is a very rare condition. So what we're seeing reported in different countries that have seen this event happen, it ranges from 1 in about 25,000 doses given in Norway to 1 in about 1 million doses given in the UK in terms of the data that's been released so far. So we've given about 900 doses, and if you look at that range of estimates that has been reported from international experience, the most common event, again, is 1 in 25,000 doses in that Norwegian report. So again, this is a very rare outcome, and we are pausing, again, out of a sense of precaution and wanting to make sure that we do extra work to be able to offer detailed information to anyone under the age of 55 if we are to restart offering this vaccine to those in the future.
Thank you all for joining us. Dr. Hinshaw will provide another live update on Thursday afternoon. Have a safe day.